So this was an individual who was over 60 years old and did not have any significant previously diagnosed health conditions prior to them becoming unwell. That is typical of Legionnaires disease. It typically affects people in their 50s and 60s. It typically affects male smokers. But globally, there are Legionnaires disease outbreaks. They do happen, and it's not unexpected, sadly, to have people die from the disease. It's about when you inhale water droplets, and that's where I've been working very closely with the environmental agency, trying to identify the source of this infection. This is a significant number of cases for Gibraltar because the last case we had was about 10 years ago. So this is a lot of cases for us to have in a short time period, hence why a strategic coordinating group has been established. They are helping support me lead the investigation and coordinating it. You know, the thrust of the investigation is to try and identify the source of the infection. And that's where I've been developing three potential hypotheses or lines of thinking. The first is that we have concurrent Legionnaires infection in the case's homes. That would be very unlikely for us to have four separate Legionnaires sources at the same time. So that's why we're starting to look at, well, could it be a single source that everybody's walking past or a mobile source moving round Gibraltar? So the case about 10 years ago here, they managed to isolate it from a car screen wash bottle. So if you just use normal tap water rather than using, as you say, the specialist screen wash, it's a nice, warm, soupy environment for the bacteria to grow, to multiply. You then clean your screen, the droplets get aerosolized, and either you in the car or somebody walking past can be exposed to the bacteria.